How's it guys, and welcome back. My name is James. This is That Med Guy. Today we will be doing sensitivity and specificity and why these are important to our everyday job and how this may impact what you do tomorrow. All right, so let me break down the lingo. Every test we do has a sensitivity and a specificity. So really, sensitivity is when it tests to be positive, it is positive, and specificity is when it tests negative and it is negative. In this diagnostic textbook over here that I've alluded to previously, you get a whole bunch of numbers with each and every test. So if we assess for cyanosis in a pulmonary embolism, there's a sensitivity to that test and there's a specificity to that test. So as you can see here, the sensitivity is like 5, or like on average about 5. It's very low, which means that if a patient with PE, or let's say you have a patient who has cyanosis, it doesn't mean they have a pulmonary embolism. But if you look at the specificity of cyanosis in pulmonary embolism, it's super high. So how do we make sense of that? So what that means is that if they are not cyanotic, it means that they do not have a pulmonary embolism, which sounds a bit confusing. So it means that the absence of cyanosis almost rules out a pulmonary embolism. But if there is cyanosis, it doesn't rule in a pulmonary embolism. So then let's go to something that has a high sensitivity and low specificity. A test that has a high sensitivity would be a tachycardia of above 90 in traumatic patients in hospital being able to predict mortality. This has got a very high sensitivity, which means that if a patient has a tachycardia of above 90 and is in hospital with trauma, they have a very good likelihood of dying, which is important for us to know because it will also play a role pre-hospitally. As we know, if a patient has a heart rate of above 100, it also has a big impact on their mortality. So what this is saying is because the sensitivity is very high, but the specificity is very low, means that if your trauma patient doesn't have a tachycardia, it doesn't mean that they have a higher mortality, but that it's a very low specificity. So whether it's not there or it is there, it's not going to have a big impact on whether it's not going to happen. That's getting my brain wrapped around this. The sensitivity is high, meaning that if they have a tachycardia, they're probably going to have high mortality. But if they have no tachycardia, it doesn't mean they're not going to die. I hope that helps. The other one that I think is the most interesting one is the anemia, and you can use your conjunctiva, which is the skin under your eye. And what this is, so it has a very high specificity but a low sensitivity, meaning that if you check a patient and you check their conjunctiva and they are nice and perfused, or it's nice and pink in the conjunctiva, you know that there's a very good likelihood that they're not anemic because they have a high specificity. Because it's not there, it's probably true. Its sensitivity is a bit low. I think it's like 50%, which means that if they are pale, it's possible that they are anemic. But if they're not pale, they're more likely not anemic. It's kind of like the opposite side of a test. It tests negative and it's very true. You must remember that every test we do has a sensitivity and a specificity. The other side of sensitivity and specificity is your likelihood ratios. So what does that mean? So it gives you a number. 1 is 0. Lower than 1 decreases the possibility of a disease or it's something being true, and above 1 increases the possibility of something being true. So for instance, a tachycardia of above 90 in patients with sepsis has a very good likelihood ratio, meaning that if they have sepsis and they have a tachycardia, it has a very good chance of adding to their mortality. Where some things have a very small likelihood ratios. So as you can see, anemia has likelihood ratios, all right? If your conjunctiva is pale, it adds almost a 50% likelihood that they are anemic. However, with their palm pallor, if their palms are not pale, it then has a likelihood ratio of like 0.3, so it takes away from the chance, but only 5% decrease in the absence of the disease, where if their conjunctiva are pale, it has a very good chance of it adding to the presence of the disease. So every single disease, every single test, every single diagnostic procedure that we do has the ability to add or take away from the presence or the chance or the absence of that disease or possibility. So guys, I hope you enjoyed this. It was a bit of a strange topic. The next video I'm going to do will be on more about what this book has to say. There's so many interesting things that they talk about, the sensitivities of like feeling for a pulse, or when you hear a wheeze, does that mean they have asthma? Or if you don't hear a wheeze, does that mean they don't have asthma? It's all very interesting. So guys, I hope you guys stay tuned. If you have any topics you'd like me to cover, I would love for you to drop some at the bottom. And please hit like and subscribe if you did enjoy this, and we'll see you in the next video. Bye for now.